Chapter 16, Prevention of Substance Abuse. This is the full video of my lecture for the Substance Use Disorder Counseling and Chemical Dependency classes. In this video, we will discuss the field of substance abuse prevention, the three primary types of prevention programs, and how to create an effective drug prevention program. This video is by David Joe Miller. Some of the material originally appeared on the counselorsoapbox.com blog. The photos are courtesy of pixabay.com and Wikimedia Commons and are licensed under the Creative Commons license. In recent years, we've seen an increase in the focus on prevention of substance use disorders. One of the reasons has been the spread of HIV and AIDS, which has increased interest in prevention. Some of the goals of prevention would be to stop diseases, to stop drug use, and to reduce crime and violence. In designing a drug prevention program, it's important to ask what is being prevented. It could be the first use. People who never try a drug in the first place don't go on to become addicted. It could be preventing continued use, or it could be preventing negative effects on society or health problems. And there might be other possible goals for a prevention program. In defining drug abuse prevention programs, we often divide the field into three separate categories. Primary prevention are attempts to keep substance use or abuse from occurring in the first place. People who never start to use will not have a problem with what is used, and this involves developing responsible attitudes about drug use. One of the ways primary prevention can be done is a television commercial, such as the "This is your brain on drugs" that was so widely viewed. This message goes out to everyone, whether they've ever had a problem with drugs or even thought about them. We don't know who's viewing the TV commercial. It might be grandma, it might be a preschool child, or it might be somebody who already has an addiction. The message is sent out to everyone in the hopes of preventing them getting involved with drugs in the first place. Secondary prevention is to prevent problems when they first appear. This could be a form of early treatment. For example, a student is caught with cigarettes or even marijuana on a school campus. We don't know if they've ever used or if they smoke or if this is the first time they've been involved. But having indicated that there may be a potential problem here, they might be required to take a drug prevention class in order to stay in the school or to be readmitted. So this is a targeted intervention to people the first time they seem to have any issues with drugs. Tertiary prevention is treatment for those with substance use disorders to prevent them getting worse, get them to stop using, or to reduce the harm from use. Examples of this might be classes for people who've been arrested for a DUI, or people who are court-ordered to go to drug treatment because they were caught with possessing drugs or under the influence. There are also three prevention models for ways that a program could be designed to deliver its message. The sociocultural model says that what we need to do is teach, and we'll use the example of alcohol here, what is acceptable drinking, what is unacceptable drinking. Drinking with meals may be acceptable, and so we teach people acceptable drinking. Some things that have been done along this line or on college campuses, posters that say the average college student drinks X number of drinks per week. Many incoming freshmen assume that people at a college campus are adults and they all drink a lot every day. They're surprised with this method to learn that in fact that drinking heavily and getting drunk is not an acceptable behavior on this particular college campus. Another prevention model is the disruption of consumption. As average consumption increases, so does the number of heavy drinkers. Heavy drinkers, alcoholics, are probably going to continue to drink no matter what you do. Very light drinkers will continue to have one drink for a wedding or New Year's. The area you're trying to prevent with this disruption of consumption model is the middle drinkers who are influenced by others and may increase more or less. So as the average amount consumed increases, so does the number of heavy drinkers. The more heavy drinkers, the more problems. Reducing consumption by making it more difficult, raise the minimum age, increase the price through taxes, reduce hours of sale. All of these are designed to reduce the number of people who drink or use drugs in a dangerous way. Another of the prevention models, it's the prescriptive model. Do not do it. No use, no problems. Something is wrong with the users in this model. So prohibition was one example of the prescriptive model. Another was the Just Say No campaign, trying to convince people that this is bad, don't do it. NIDA, the National Institute on Drug Abuse, has principles for creating a drug abuse prevention program. And their principles involve increase protective factors and reduce risk factors. Having more after-school activities reduces the number of kids who are hanging out with nothing to do. Strengthen families, improve social, emotional, academic skills. The more people who are successful, the less likely they are to begin to engage in drinking or drug use. You want to smooth transitions and provide prevention programs at multiple places. So the same curriculum might be used within a school district in varying forms at grade appropriate levels for elementary, middle, and high school. You want to adapt programs to the community without losing key elements. This would be especially important if the program was in an area that had a particular racial or ethnic group. To be effective, the program should be long-term, repeated, and stay on the same message. Parent training, teacher training, and effective management is also important. And it's important to involve children and teens in the creation and management of the program. Some current topics in the area of prevention we should consider. One is involving parents. Ideally, in the educational system, parents should always be involved at all levels and in all ways, but it's a real challenge. Sometimes parents have a lot of other things to do. We see cases where both parents work maybe 6 days a week, so they can't take a lot of time off from their work to be involved in these programs. But whenever possible, the program should be structured to inform and get feedback from parents. Resistance skills training can be very helpful. Some kids, especially in younger grades, younger ages, or people who are more introverted or less assertive, may have difficulty in simply saying no. It's easy to give in when somebody asks you if you've never considered what you're going to do. Multimedia with the same message, both the program, the TV, what teachers say, etc. Tailoring programs for subgroups is also important. And any program on drugs has to talk about the legally tolerated drugs. Alcohol, which is really built into our society. Tobacco, which for a long time was commonly used and even encouraged. And now marijuana, which is becoming legalized. So each of these, the fact that once you begin using one substance, it may be easy to move on to stronger substances, is an important topic. Also, there are things we can do to reduce the risk, and those are important to include in programs. And we want to reduce the advertising aimed at children. Think of some of the ads for alcohol or tobacco, which featured cartoon characters, which had posters in the corner convenience store that were down at a low eye level where children were likely to see them. The more we can reduce the advertising aimed at targeting at children, the more effective our prevention programs may become. One of the criticisms of drug abuse prevention programs has been, do prevention programs simply amount to advertising for drugs? Some of the students who went through drug treatment programs in past years came back with a list of drugs they'd learned about and with a desire to, when they got older and could find these drugs, try them in the first place. So we want to be careful that providing too much information about drugs and alcohol, that we don't glamorize them or make them sound like something that the person who's getting the prevention program might want to do. Which works better? The field of substance abuse prevention has been divided between two philosophies. One is to teach drug resistance education, just say no, how to avoid it. The other has been to teach positive life skills with the idea that the more positive things going on in someone's life, the less likely they are to get involved with drugs and alcohol, and the less likely they are to have a problem with this. My personal view and what I think the reviews of evaluations of programs have indicated is that the best programs include both elements. They include thinking about drugs before the first exposure and encouraging kids to know how to say no and avoid risky situations, but they also encourage things like hope and education and the idea that you can have a successful life without the need to use drugs or alcohol. Some other prevention initiatives. Social host ordinances. I know in the county I live in and many other counties there are programs that say if adults allow underage people in their home to drink, they are responsible for that behavior. Not only if the teenager leaves the house, but the adults who serve alcohol or allow alcohol to be consumed on their property can be fined. The last I checked, a fine in this area is about $300 per teenager that was served alcoholic beverages. That's a powerful disincentive to keep people from allowing underage people to drink on their premises. Another area is worksite prevention programs. Some worksites have a problem with particular drugs or alcohol being used on the job or after the job. Discouraging that kind of usage can be helpful to a company. Having employee assistance plans that encourage people who do have a problem with drugs or alcohol to go for help can also be valuable. Setting college drinking norms. I know I mentioned before, many freshmen coming into the college believe all college students drink every night. And in fact, we find that it's typical that college students, particularly at the community college, who are adults, may have jobs, may have families, may not drink one drink a week. So letting the incoming freshmen know that it's not common to drink a lot every day can reduce their exposure to drinking or other drugs. There's also the area of what's called harm reduction. It's been highly debated, but it's a possibility in some cases where we've made marijuana less illegal or legalized it for certain uses. Things like safe injection sites. In Europe, there are places where a heroin addict can go to a doctor, go into a little injection room, they're given a needle and some heroin they inject, and then they go and they dispose of the needle there. This prevents them being out on the streets, dirty needles. They use only clean needles, and they get their dosage each day. I know it's still controversial, but the areas that have used safe injection sites or clean needle exchanges have found that it does reduce disease transmission. There are things like wet houses in which people who are low income who go into public housing are allowed to consume alcohol on the premise. And we have methadone maintenance clinics that people who are addicted to opiates, principally heroin, can receive methadone dose each day there rather than having to do illegal activities to get their heroin dose. Chapter 16, Prevention of Substance Abuse. Here's some of the terminology that you need to know. You would need to know the difference between primary prevention, secondary prevention, tertiary or third stage prevention. You should know about social host ordinances and employee assistance programs. Also, we didn't talk about it in this video, but one thing that's often done in treatment programs is to talk about values clarification. If you want positive elements to your prevention program, you have to help people get clear on what really matters to them. Is it family? Is it their religion? Is it getting ahead on the job? All of those values are inconsistent with a lifestyle in which someone drinks or uses drugs. So what should the student have learned from this chapter? Well, while I think with every chapter it would be wonderful if they learned everything in that section, the three big things to take away from this video are what is primary prevention, what is secondary prevention, and what is tertiary prevention, and to understand examples of how each of those might be constructed. So what's next for you? What have you learned in this class, in this series of videos, and what will you do with this learning? This is something I ask my students at the end of each semester class or quarter class. I think it's important to reflect on whether you got anything out of this and what you're going to do with it. For those of you watching all these videos, this will be the last in this series of substance use disorder or chemical dependency videos. For me, I will continue to create other videos and other materials, blog posts in related areas such as mental health and having a happy life. Right after this, you'll see an end screen which will give you links to the various series of posts that you might be interested in. Thank you for watching this, and I hope the series on substance use disorder has been helpful to some of you.